Good morning, everyone. I'm Dion Shuby, the CEO of CHP Australia. Thanks for joining us on this frosty Thursday morning in Sydney. I realise there are other people in other parts of the world where you may be a little bit warmer, but nonetheless, thank you very much for joining us. It's good to have you with us. Now, it's my pleasure to welcome back Will Colley. Some of you may recall him from the last year's presentation, welcoming him back to present again on the Edelman Trust Barometer. Now, just briefly, by way of introduction, Will leads the Edelman regional health team. So this is everything in the APAC region, formerly in the US and other parts of the world. There's one thing that's struck me about his CV. He sees health as a community effort that requires business, media, government, and patients to work hand in hand to achieve the best outcomes. That happens to be one of the values that we subscribe to. Whatever we need to do in health needs to be a relationship, a stakeholder, a partnership arrangement to get the best outcomes with, first and foremost, at the center of it, of course, consumers. Now, last year's presentation was sort of covering the APAC region more broadly, but Will tells me that today there's going to be a strong focus on Australian data. So with that, thanks again, Will, for joining us, and over to you.
Thanks, Dion. I really appreciate that. I'm hoping that folk can hear me, and that I'm coming in loud and clear. And yes, Dion, to that point, I'm really excited today because I get to talk through a new set of data, which Edelman does every year, right? We've talked about trust for a long time, but last year I presented both to this group, Medicines Australia, a group of other health leaders across the region, across the country, and overwhelmingly the feedback was, this is really interesting, but gee, wouldn't it be great to have Australian data? So this year we went back to our global colleagues and said, listen, it would make a huge difference if we could invest and conduct this research in Australia as well. And we also added Singapore to the mix this year. So globally, we have talked to 16 different countries with about 1,000 people per country. We've added Australia and Singapore to the mix, in addition to China, India, Japan, and Korea across the region. And so today I'm going to be taking you through the APAC regional data. You will see some global data in here as well. But really importantly, and potentially for the work that you do, you're going to have some local data that you can actually rely on and utilize to, if you need to make the case to folk within your businesses or stakeholders that you work with around why it's so important for us to think critically through trust and its impact on health in Australia. A couple of quick things before I get in. So we've been studying trust for about 30 years, but we've been conducting this particular study for 3. So like I said, we've added Australia and Singapore this year, but over the last 2 years, there have been some key themes that continue to come through. The first is that there is this dispersion of authority that has occurred post-COVID. So we've seen friends and family started to be just as trusted as scientists and medical experts to tell the truth on health. And that is meaning that our authority on who makes the decisions and who makes the recommendations is shifting. We've also seen this really interesting phenomenon of self-guided health, where about 1 in 3 people believe that if they do their own research, they could probably know about as much as a doctor. It's a kind of a hysterical thing to think about when you see that number, and the idea that someone could go to their computer, do a bit of research, and they'd be as well as informed as their physician. The third one is around politicization. This is a touchy topic. I've now presented to, in Australia, the majority of the pharmaceutical community, as well as the medtech community as well. And what we're talking about here is the impact of when politics gets involved in science. And we're going to talk a lot about that today, and the impact of that. And then the last one is around innovation. About 50% of all people believe that innovation is being managed poorly, not well. And I'm going to take you through some specific examples of where innovation and technology in the health sector for Australians is really concerning. So these are the major themes that we've seen. And before I get into this new set of data, I just want to take us back a moment to January. If folk on the call have spent any time with Edelman over the last few years or paid attention to any of the work that we've done, we did this huge global trust launch. It's with the World Economic Forum. We launch it at Davos, and it looks at the state of trust with all institutions. And there were just a couple of pieces that came out of that I thought were relevant for today's discussion to set the scene before we look at the health sector itself. So historically, Edelman has built this thing called a trust index. We essentially ask people, pretty simple question, how much do you trust these institutions to do what is right? Do you do the right thing? Just like in any relationship that you would have with a partner, with a colleague, with a workplace, with your local sporting team. So I ask people, how do you feel about institutions? And those 4 institutions that we look at are government, media, business, and non-government organisations. And Australia for the last 2 years has sat somewhere around about 50%. Last year, globally, we saw Australia coming in at about 48% of people saying that they trust institutions to do the right thing. This year, a slight increase of about 4 points. Sadly, what we're going to see within the health sector is that does not ring true. There's a slight change in the way that people think about the health sector and different components of how they're actually getting health. But again, a slight increase in the way that people think about total trust, and that's across all sectors. So food and bev, technology, health, all of the others. A couple of quick things before I get into it, right? So the first big headline is that globally, people believe that government lacks competence to regulate emerging innovations. So here you can see on the left, we've got the global in the light grey, just a bit of kind of housekeeping, a little bit in the light grey. The dark, the black line on the left is APAC. And you can see that in Australia, almost 2 out of every 3 people say that government regulators lack adequate understanding of emerging technologies. So we're right up the top of all of the global companies that we talk to in our global, all of the countries that we talk to in our global data, really essentially saying that the government's not quite doing the right thing. And in APAC, it's about 1 in 2 who are saying that's the case. Oops. Similarly, when we break that down and look at the science sector and think about how medicine and science is being executed, it's about 2 out of every 3, or 60% of people in Australia say that science has become politicized. And similarly, if we look across government, about 55% of people have said the government actually has too much influence on how science is done. Now, remembering one of the things, there are some limitations around the way that the study is done, and if you want to kind of dig into the questions, it's always very easy for us to say, well, it depends on how the question is asked. That's all very true. But I want you to keep in mind that we ask the same question of every single country, of every single respondent. And so what we're seeing is that regardless of whether you're in Japan or if you're in China or if you're in Australia, we ask the same question. And what we can see is that there are high levels of skepticism around the way that science is becoming politicised in Australia, and also similarly quite high levels of concern around government influence on how science is being done. So that's the global data which we release in January. Now I'm going to move into the new data that we launched in late March, and there are 3 major themes. I'm going to try really hard to move as fast as possible to get through them, and if I do see questions in the Q&A, I'll try and get to them in the moment. Otherwise, I'll come back to them at the end, and look forward to hopefully a bit of a discussion around that as well. But the first theme is around politics and misinformation. The second theme is around the doctor being the linchpin of health trust, and the third one is looking at a new model of how trust plus empowerment delivers best outcomes. We're really excited about the concept of empowerment and how that actually mobilises, particularly in a post-COVID Australia. So first one. Okay, so here's the first doozy, right? When we look across all institutions, we talk about media, we talk about government, non-government organisations and business. The only institution where we see a positive or trusted relationship is with the employer. And so in many instances, I'm talking through this data with people who have a responsibility for employee communications. There may be folk who are on this call who are in an agency relationship where they're focusing on communications as well. But overwhelmingly in Australia, the employer is being seen as the one where people trust to address my health needs and concerns. You're going to hear me come back to different ways to sort of split that with slightly different questions throughout the day. But the employer is the number one institution that people are saying, you know, to address my health and needs and concerns is my employer. Sadly, media, very, very low across the board. But when we look at that top line for Australia, media down at 31% of people, government at 43%, NGOs at 46%, and business sitting somewhere in the detractor space, 10 points behind the regional average. So there's something that's slightly wonky in Australia with companies and the way that people are thinking, general public are thinking about getting their health needs addressed. Similarly, we've seen a decline over the last 12 months with healthcare companies in being trusted to do what is right. And again, this is a very straightforward question. I trust healthcare companies to do what is right. So down 5 points to 58 globally. But in Australia, it's about only 56% of people are saying that they trust healthcare companies to do what is right. I should note, you'll probably notice the UAE, Nigeria, Singapore, Australia, these are all countries that we've added into the mix this year. And so for Australia, again, the non-applicable there is because we don't have a year on year. You'll see Korea, Japan, and the US right down the bottom. But again, Australia kind of lagging in this middle sort of apathy sort of place in neutral territory, which is a good opportunity for us, right? There's risk always, there's threat always, but a good opportunity for us to think critically about, well, what's going wrong with healthcare companies in Australia? Why is it that people might feel that way? I want to make a quick point, which is that when we conduct this research, we ask people what they feel and how they feel. We don't ask people why they feel that way. That why is a much more difficult conversation for us to have. Obviously, the way that the survey is conducted means that we're looking at quant rather than qual, but we certainly have subsequently talked to a few people and got feedback from within the industry, and I think I'd be really interested in folks' perspectives on the why that might be even today, if we've got time. Okay, so if we break that down into demographics, it gets even more interesting. We've got this young group of people under the 18 to 34 age group who have a relatively high level of trust in healthcare companies in Australia. However, people in their in 55 plus, it's neutral. So about half of people saying that they do not trust healthcare companies to do what is right. And if we then mash that against low income earners, so if you're an older Australian on a low income, you have a much higher level of risk or a much higher incidence of suggesting that you don't trust healthcare companies to do what is right. And I should also make the point that when we say healthcare companies, we deliberately say healthcare companies very broadly. We're not saying pharmaceutical or medical technology or consumer wellness companies. It's just healthcare companies in broad, which obviously presents a slight limitation in the way that we kind of define that and cut up the data itself. This one has been probably the most significant finding for us over the last couple of months in terms of talking about trust in media. I think it's pretty clear to anyone, it doesn't matter which country you're in or which sector you work in, that there has been a crisis in trust in media. However, what we've found over the last 5 years since asking this type of a question is that trust in media to report accurate information about healthcare has really plummeted 14 points since 2019, so around the pandemic. In Australia, however, it's even more significant. We see only 30% of Australians saying that they trust the media to report accurate information about healthcare. And as a career communications specialist, as someone who started out wanting to be a journalist and moved into health communications, there's really a sad sort of sight for me to see. I know there are a few folk who are on the call that may have relationships relationships with key journalists, healthcare journalists from around Australia. And many of you will probably know that Sudan Levy's news from the last 2 weeks being made redundant just adds to this concern that we have around the way that Australia is thinking about health media and health reporting. We'll probably have a little bit of time to talk a little bit later about what's happening within the media institutions, but overwhelmingly, Australians are saying that there is a problem, right? And we don't trust the media anymore to give us the right information, to give us accurate information. When we break into demographics, that story even gets a little bit worse for us. Again, across age groups, young people are saying that media is basically something that they're completely ignoring. So only 26% of people aged under 34, only 27% of people aged under 54, and 35% 55 plus. So it's really, really significant in terms of the way that they're turning through. I don't want to talk too much today about Gen Z or demographics, but certainly, as we've all probably seen through our marketing efforts and our communications efforts, there's a real shift that's been taking place with young people. I want to make the point, it doesn't mean that health media is dead. It doesn't mean that journalism is dead. It just means that it's in trouble. And we need to think very, very carefully about how we support media institutions to become more successful in driving trust and communicating with Australians about matters of health. And again, you can see that that lies across both income and politics. Which, for the record, where you see non-applicable there on the bottom right-hand corner, it's because not enough people identified as being right voting, and too many folk from left and centre. So we don't have enough folk to have a statistically significant number for Australia identifying as right sitting. Okay, so I talked earlier on about politicisation of medical science. And so we asked people, of all of the barriers and the things that you're worried about, what are the top ones for you to consider? This one's really, really interesting. And if we just start from the right-hand side, across the region, across the globe, what we saw is that number 5 was health information. Number 4 was access to technology. Number 3 was that people are concerned about a pandemic. But number 2 and 1 were affordability, as well as the politicisation of medical science. In Australia, it's very similar, but we see a slight kind of tweak. People are concerned about whether they can pay for the care that they need. They're worried about affordability, but almost as many people are as worried about political interference and political meddling with medical science in Australia. Again, we don't ask people why they feel the way that they do, but if we were to speculate, you would think about the last 5 years, maybe the last 4 years, and say there have been some pretty significant moments that have occurred in Australia where politics have been, and politicians particularly, have been at the forefront of health delivery, which probably has resulted in many Australians having a very high level of distrust. And if you look at that global number with a 13-point increase year on year, it suggests that there's a really significant problem there around the way that Australians and globally people are thinking about politicisation of medical science and care. This one's really astounding. 1 in 3 people in Australia regret a health decision they made based on misinformation, and almost half of all young people, so 47% of people aged under 34. And when we asked them who they thought they were misinformed by, there is a longer list. We have quite an extensive appendix with all of the data. But when we asked them who they were most misinformed by, number 1 was their friends and family. And historically, what we've seen, as I mentioned earlier on, is this dispersion of authority where people are making their own decisions. They're talking to their friends and family, somebody like me. But there is this really quite significant concern, especially with young people, that they've been misinformed. So, I talked to my mum and she said, well, this is what I heard, or I talked to my friend and they said, this is what I heard. That problem in hindsight is becoming quite real for us. The second audience who had potentially misinformed is the doctor or the healthcare provider. And so that could be the pharmacist, it might be the nurse. We conduct this with language that we use that can be applied to all markets. And so you'll hear me talk about healthcare provider today. What I mean is a doctor or a general practitioner. And in Australia, I think GP, nurse, and pharmacist. But you'll see that language coming through pretty regularly. And then the third one, perhaps unexpected to anybody, was a content creator without any medical training. And this is a hot topic for us across both the consumer wellness, the pharmaceutical and the medtech space. We're thinking about how to use different channels. We're trying to think about how we can apply new approaches to building credibility and trust with people around health. But unfortunately, what we might have seen in the last couple of years is some problems with folk who just don't really know what they're talking about, getting involved in pretty high stakes or important health conversations, and accidentally influencing people in the wrong way. So again, almost 50% of young people. Interestingly, those folk over 55 in this instance are not saying that they regretted a health decision, with only 25% of people saying that. But there is such a significant difference with young and older Australians in terms of how they are receiving information. So something for us to be really careful about and conscious about when we're thinking about, channel strategy and audience and stakeholder mapping. This one blows my mind. So 4 in 10 young people only trust a provider if they're aligned with their politics or social beliefs. So to play this out, we think there are a few things that have been happening globally, particularly out of the United States. It could be with regards to right to life. It could be with regards to positions on environment. It could also be related to diversity, equity, and inclusion initiatives. However, what we're seeing in Australia is that over 40% of young people have essentially said, I can be sitting there with the very best physician, the very best surgeon in the country, but if I don't agree with their stance on politics or social considerations, I'm probably going to look for a new healthcare provider. This is quite astounding to me. I mean, I think the older you get, the problem, maybe there is some theory to think that slightly changes. But what we're definitely seeing with young people is that they're saying, no, I need to know that these people align with my values. And there's been a big discussion over the last 12 months around values, around purpose, around mission, and the role of chief executives and leaders within organizations addressing those issues that take place. Now, what we're seeing is that that's also crept into providers with healthcare professionals as well. Okay, so earlier on I talked about technology and innovation, and this one's really exciting. I earlier this week was presenting to a group of medical technology marketers, and this one kind of stopped everybody. What we're seeing in Australia is that over half of people feel that technology will have a negative impact on healthcare over the next 5 years. And we've defined that, as you can see, in cost and any unforeseen issues. There's a big concern around health privacy and information, and potentially even worse outcomes. And that's been an 8% increase since 2018. And so essentially what we're seeing here is that people just don't quite, so I think it's kind of connected to what's happening within a distrust of the entire health sector. They're saying technology is going to come in. I'm not sure that this is actually going to be the best thing for me. I'm maybe a little bit more conservative in the way that I think about healthcare delivery taking place. But when we break that down, what do we mean when we say technology? I've got 2 great examples of where this is happening. The first one is in the use of artificial intelligence. We're doing a lot of work around AI. We're thinking about large language models. We're considering how to apply this in the type of work that we do with patients, with physicians, in the systems that are being built, and even in some of the communication strategy that we're building out as well. But Australia, interestingly, is the most hesitant to adopt the use of AI, and in this instance around the patient interaction. I just wanted to pull this out to give you some context of where we sit across the region. Only 12% of people actually embrace the use of AI in the patient interaction. And so when we talk about adopters versus detractors, this very, very small group of people in Australia saying, actually, no, this is a good thing and I believe in it, and far above the rest of the region, people saying they reject. The inverse is in countries like India and China, who have such booming economies, such interesting open minds to the way that we pull that through. And so the concern for me here is that there is this very small gap. And when we typically think about how we influence or we change perceptions, we're talking about how we can move people from one side to the other side, but that gap is very, very small. And particularly in Australia, we're seeing this huge group of people saying, I just don't want a piece of it, I don't trust it. I think we've got a lot of work to do when it comes to these types of initiatives. And when we break that down into a couple of other pieces in Australia, the two other areas that are really, really interesting are around drug development and around medical diagnosis. So like I said, patient interaction. And for the folk that are on this call, the patient interaction is actually really interesting. I think it's probably something that we're probably all thinking about. How do we help people make more efficient decisions? How do we help them get better information at a lower cost, faster? That's how these types of things are being considered. For the folk that we're working with in diagnostics or in medical technology or in drug development in the pharma side of the business, to a certain extent within consumer wellness as well, a very high level of hesitation, right? Again, this rejection from Australians around AI innovation. And this, I think, is a pretty interesting discussion for us to have more on a philosophical standpoint. Like, why is that happening? I don't know whether this is applied to other sectors, say to technology or to food and beverage or other parts of the Australian business landscape, but certainly in Australia, we're seeing this really significant numbers. And the other example I just wanted to give you of where we've talked to people about technology is in gene-based medicine. It's probably fair to say that as one of the caveats, 9 out of 10 Australians, even with the definition of mRNA vaccines or gene splicing and gene therapy, still probably don't know what gene-based medicine is. If I talk to one of my parents or maybe one of my siblings or even friends, most people wouldn't necessarily know what gene-based medicine is. And as a result of that, we're seeing pretty low levels of trust in gene-based medicines in Australia. But if you suspend the theory that most people don't know what gene medicine is, if we apply that across all countries, right? So globally, across all countries, Australia is still right down the bottom of the barrel, right? Right down the bottom of the barrel. There's no reason to suggest that any of those countries to the left or the right have any better levels of education around what gene-based medicine is, but there is quite a concerning level of distrust in Australia of gene-based medicine, which, if we assume that we have the same level of education, there's a problem that's taking place here with regards to this issue. I want to make a point right now before I move into the next section. We spent a bit of time with Natasha Robinson and different journalists from across Australia. Natasha and I sat down a few weeks ago and she said to me, Will, I actually think that there might be a more significant problem here, and it could be that we're looking at a crisis of trust in the public health system in Australia, which means that any time our public health system provides education or innovation, therapeutic updates, the level of skepticism that exists within the Australian community means that the ability for them to adopt this new innovation is even more difficult. And so perhaps there is an actual problem that's taking place, which leads us pretty neatly into the politicisation argument that we were making before, that I was talking through before. Okay, I can see. Oh, that's good. Thanks, Janelle, for the question. I didn't see your question before, but I think you heard me say before, we don't define for patients or for people who respond to the survey, healthcare organisations. But from my perspective, we look very closely at pharma, medtech, and consumer wellness. I would argue, to your question, it also includes the health system itself. And similarly to your other question, we do look at the demographics that exist, but I don't include them in this presentation. So we can pull out for you if you're particularly interested in whether people speak English as a first language at home, level of education, if they were born in the country. We have those types of demographics as well. We just don't split it for this particular part of the for this part of the presentation, but we can definitely do it. So thank you for those questions. Okay, so this is getting interesting, and I think pretty important for this group of people. So essentially what we're seeing here is when we ask people, who do you expect to play this? I don't love this language, big or huge. I think it's like play a large role in making sure I'm as healthy as possible. Overwhelmingly, what we're seeing is that Australians have decided that they can really only rely on themselves. So we've got an 8-point increase for Australians globally. Globally, we've got an 8-point increase to 85, but Australians are above that, right? So we're essentially saying, I really don't think I can trust anyone. I'm just going to have to make my own decisions for me around what's best for me. And so we're going to talk about empowerment shortly, but this is a really important factor for us when we think about how Australians make their own decisions. Earlier on, I said to you, there's a crisis of trust in media. There's a crisis in trust of companies. We've got to think really critically through what are the channels that we're going to do to reach, that we're going to use to reach these people. Importantly, though, the primary care provider, again, the doctor, maybe the pharmacist, I'll get into this very shortly, are being seen to be the most credible. But when we look at government, employers, business, NGOs, and media, remember this, the specific question they're asking here is to make sure I'm as healthy as possible. All of those institutions are very, very low. Earlier on, I talked about the employer being high, slightly different question. But in being as healthy as possible, overwhelmingly, people are saying it's me. I have to take responsibility for my own health, which is a great thing to hear and also a good opportunity for us. So let me just dig into that primary care provider, right? Again, the question here is around telling the truth. So the percentage of people who trust each of the following to tell the truth about health issues and how best to protect the health of the public. And we do ask slightly nuanced questions to help us better understand and unpack. But when it comes to protecting the health of the public, the primary healthcare provider is now at the top of the roster. We have seen an increase globally around the GP and a decrease for the pharmacist. And for those of you who've been working in the pharmacy in the consumer retail space for a long time, we often talk about the pharmacist being the trusted source of truth, the one that people go to. In Australia in the last 12 months, what our data is suggesting is that this has become a slightly different and more complex environment, with the primary care provider being seen as number one. And if we go back to what I said on the previous slide, right, with the number of people talking about their physician, we're certainly seeing in Australia, when we ask it this way, that when it comes to protecting the health of the public, that the primary care provider is one. It's not to say that the pharmacists and friends and families aren't helpful. They're all deep into the blue trust territory, but unfortunately, we're seeing a slight decline with pharmacists across the region. Now, on the right-hand side, perhaps again quite controversially, you'll see in the top line across the global 12 that we talk to, 35% of people have said journalists, with a 10-point decline. But in Australia, it's only 24% of people saying that they trust them to tell the truth about health issues or how to protect the public. Again, this is one of those things we've talked to Natasha and a few other journalists about. And, you know, in fairness to those poor journos who have been working in the health sector over the last few years, many of them have come into the health sector without any particular training. Of those that have been in the health sector for a long time, they're moving incredibly fast with information that continues to change. They certainly feel a high level of concern that the information that they provide that then has to change has contributed to a decline in that trust as well. But that's also being tied up with government leaders and healthcare CEOs as well. So there's real kind of issue that's taking place around that group in terms of how the media portrays, how government talks about itself, and then how healthcare CEOs think about their role when it comes to protecting the health of the public. Quickly, I'll just jump in on this one. When we look at the opinions on public health policies, down on the bottom right-hand corner, and this is probably not too surprising, global health authorities, only about 16% of Australians are feeling that they're most influenced on public health policies. National health authorities, only 24%, 36% of people saying that medical scientists or health experts, and then finally primary care providers, that they're the ones where it's sort of coming through there. So again, at that point on the right, you've got three 3 times more chance to be utilising a primary healthcare provider rather than a global health authority. And if we think about, again, we're now out of the darkest days of COVID, but I was reminded the other day of the daily work that we were doing. We would wake up each day and we would watch the news and we would see the numbers and we would listen to the bureaucrats, and in some instances to the health minister and the chief scientists. It's the primary care providers, the GPs, who are the ones that are most influential for us and going to have the most impact. Okay, so on to the third part of the discussion, and I think I'm making okay time. This is about empowerment. So one of the things we've talked about trust for a very, very long time, right? Edelman's talked about trust for a long time. And the reason we do that is because we pretty fundamentally believe that trust is one of the leading long-term indicators of business success. Like I said earlier on, it's also a good indicator of relationship success with your partner or, with your colleague, your client. If you don't trust somebody, you're far less likely to engage with them. If you do trust them, then you live a happy life. However, what we've found from a health standpoint is that trust alone may not be enough. And so that's why this year we're starting to talk about empowerment. And when we say empowerment, importantly, we mean confidently making decisions, informing yourself, speaking up to your primary care provider so that you can make decisions with them, not have decisions made for you, so that you can tell good information from bad, right? Think about misinformation and the kind of issues that we've seen around the proliferation of misinformation throughout COVID and post in the internet and other places. People feeling like they're in charge of their health. And then most importantly, people believing that their health decisions are most important. Right? This is primary. My health is most important piece. So that's what we mean when we talk about empowerment. And I really love that we're including empowerment into the mix because it really changes the way that I have thought and think many of us have thought about how to create impact. So going to tell you a fun little story about my buddy John, who's a real person. So Dion mentioned earlier on, I spent a bit of time in the United States, out in Chicago and Los Angeles for about 7 years. And during that time was really lucky to meet a whole bunch of people from different parts of the health industry, from the communications and marketing sector, but also make some really great friends. And one buddy of mine named John, who is from Florida but lives in California, he's in his early 40s. He's a good-looking, fit, strong guy, goes to the gym, eats the right stuff, makes the right decisions, but is also a really, really anti-vax campaigner. And I think it's important to make sure that we have varying perspectives in our friendship groups and those folk that we spend time with. But John is a great example of someone who feels entirely empowered in making the decisions that he does, that I talked about earlier. He's confident in making his own decisions, right? Eats the right food, gets up early, exercises, gets a bit of sun, swims, does all of the right things. He also does not want to get vaccinated. And throughout that process, I know it's becoming a little bit older now, but his choice to not get vaccinated was something that he made because he felt very empowered to make the right decisions on his own behalf. Because he didn't trust the institutions within the United States to be making the right decisions for him. And we probably all know someone like John. He is a real person. He's a good mate of mine. We all probably know someone like John who is making their own decisions for themselves because they do not trust the institutions to do the right thing for him. So this year, what we have found is that when we mapped those who are empowered with high trust against those who are unempowered with lower trust, we see a huge 22-point increase in the likelihood that people will suggest that they have good or better health. And for those who say they are unempowered but have high levels of trust in the system, there is a 19-point increase in those people's likelihood to report good or better health. And so historically, what we've been trying to do is talk about, well, how do you build trust? How do you make sure that people trust these institutions and do the right thing based on the guidance that we've had? But we haven't really thought about how to empower people to do that. And so this is where we're starting to shift our thinking to say, unless you do both of these things, build trust, but also empower, you will never get to that top right-hand corner where we need people to be able to declare that they feel that they're good or better health. And part of our challenge now is to think about how we empower people to do that. And maybe not surprisingly, one of the key areas for us to do that is the way that we communicate and the way that we take responsibility as marketers, as manufacturers, as researchers, to help more people understand how they can take ownership of their health and how they can build those pieces in. So those two axes this year we're really excited about. We don't necessarily have the right answers yet, right? But what we do know is that if you have higher trust in a health ecosystem and you have more empowerment, you will declare that you have a better outcome. And that's what we're all looking for, right? Better health outcomes. So when people are empowered, they take slightly different actions. Firstly, they vet health information. When you take a look at this, among empowered people, those with higher trust are more likely to confirm information with a provider and look across sources. Similarly, those people who declare that they are empowered, they have a routine physical exam or a checkup in the last year. So 70% of people who say that they're empowered and have higher trust went and told us that they got an annual checkup versus 60% of those who are empowered with lower trust, or only 55% who are unempowered and lower trust. And similarly, if you remember the innovation slide that I showed earlier on with Australia, of those who are empowered with higher trust, 41% of people say that they embrace innovations. Again, the use of AI in patient interaction, diagnosis, and drug development. So there's huge increase with people when they are feeling empowered as well as trusted. A 16-point increase more than those who are unempowered or with lower trust. So this starts to help us get a little more granular around why this stuff matters. Because unsurprisingly, these people then begin to look at how they manage their own health. And globally, sadly, only 2 in 3 people feel empowered to manage their health. But interestingly, in Australia, it's about 70% of people say that they're empowered to manage their own health. So you can see the global, we've got about 65% saying that they are, about 35% saying they're not. In Australia, it's a little bit higher than that. And so if we go back to what I've been saying today about trust in Australia, very low levels of trust, but actually quite high levels of empowerment. What that's suggesting to us is that Australians, to that data point, is saying, you know what? I'm going to just make my own decisions. I'm going to do my own research. I'm going to talk to my own people. I'm going to go ahead and do my own thing. But in saying that, there is some risk, right? Because we all know from that data that I talked about last year, that dispersion of authority and the ability to influence and research, with 1 in 3 people saying, well, I can go and do some Google searching and I'll know as much as my doctor. There's some risk that exists in there for health outcomes, but also some opportunity for those of us who have responsibilities for patient advocacy, who have responsibilities for disease awareness, and who have responsibilities for bringing new medicines or therapies or technologies to Australia. An opportunity for us to educate and help people to build trust as well as empowerment. Importantly, from a global perspective, of all of the people that we talk to globally, only 4 in 10 people say that they feel empowered and also trust the health system. So previously, I'm only talking about empowerment, right? So 7 out of 10 Australians, with about 6.5 out of 10 globally saying they feel empowered. But when we map that against trust, it drops to 4 in 10. So it shows us that there's a pretty significant gap with the trust and the empowerment component. It also shows us where we have some opportunity to shift people. And really, typically what we would want to try and do is move people out of those boxes into that top right. The question of how we do that becomes really important. I'm getting close. Yeah, I'm getting close on my slides. So we're almost getting there. So very quickly, I just want to talk. Oh, sorry, I can see Bernard. There's a question in there from Janelle. Bernard, did you want to toss a question in? I don't know if you can ask live. I'll have to come back to it. Okay. So the first thing that we want to do when it comes to thinking about how do we actually build empowerment and earn trust is to address the barriers to better health. So what are the key barriers that people are saying that they're worried about? And in Australia, half of people say that cost is the biggest issue, right? So the biggest barrier preventing people from taking better care of their health is cost. They're saying healthy options cost too much, they can't afford good healthcare, and they can't afford treatments. Secondly is information. This is a really important one for us. Over 40% of people saying that they got contradictory expert advice, or there are changing health recommendations, or a lack of information. I have a hunch that that lack of information is also confusion around where the right information should come from, which presents again an opportunity for us. And then the third, maybe not surprisingly, is access. So difficulty accessing health services and a lack of institutional support. And that would be exacerbated by people who live in regional areas. As we all know, access to physicians, hospitals, pharmacists being a really significant barrier to helping Australians take better care of their health. But importantly, when we take a close look at how to build trust on health across all of the organisations, and this is across the region, prioritising reliable information continues to come up as the number one. So just here I'm talking about some of the barriers, so cost, information and access. Across all of Asia, what we saw was that being a reliable source of trustworthy health information was consistently the number one driver of trust and empowerment for folk. You can see for business, right, when we talk about how we help business, number one, be a reliable source of trusted information, but also help people address barriers from taking better care of their health and develop products that help me manage my health. Kind of self-explanatory, that's what we would expect. For NGOs, and in our capacity in Australia in particular, this would be patient advocacy groups, it could be policy thinking groups as well. Again, number one, reliable source of information. Number two, educate me on how I can improve my health. And number three, build better support, build support for better health policies and programs. So this one suggests to us that NGOs have a responsibility, and we're looking to NGOs to help us communicate and educate, but we also want them to have a voice. I think NGOs would say the same thing. They need to have a voice in regards to how policy is being built. And then for government, again, it's at the top of the pops. Number two is that Australians told us that, and across the region, they told us that they want health workers to be funded. We all talked about the compensation for nurses throughout the pandemic and people working in hospitals, but also thinking about how we fund underserved communities. And then finally, it's that access part, making quality, affordable healthcare available for everyone. We, of course, are very, very lucky in Australia to have such a fantastic health system that does create and provide a safety net. But this continues to be one of those top three drivers for people across the region. I want to just point out this point. This is from June 25. Actually, when we launched this data, the day after, it was June 26. There was a story that had run on Pharma in Focus at the ARCS conference, where of a room full of industry professionals, 90% of them said that they were currently feeling symptoms of burnout. And I thought that was really fortuitous, despite being quite terrible, because when we talk about employers, and earlier on I talked about the role of employers to gain trust, they have to empower healthy behaviour. And so this is essentially just saying you have to, walk the walk. And there are three key areas that employers needed to be thinking. So if you have got a role as a people manager, or if you're have a role as a company director, number one is about thinking about how we make special accommodations for those with health or caregiving caregiving needs. That could be about a parent, it could be someone with a chronic disease, but thinking really critically how we do that and make that available. The second is about making sure that the CEO speaks out to address public health issues that are relevant to their employees. That second part is really, really important, relevant to their employees. It can't just be about something that they, decided they wanted to get on board with or watched on television. It has to be relevant to the people. And there has been some skepticism with regards to CEOs speaking out on purpose-driven initiatives, but we are still seeing that, to help people believe that their employer is going to help them empower to gain trust in the health space. The CEO needs to be able to build that as well. But then the third one, and this is why that burnout story is so important, is that our CEOs need to model healthy workplace behaviour. So we all have a responsibility, if we are a business leader, to ensure that the people that report to us and work with us see us balancing overwork, managing stress, and taking time out. Like really kind of being human about this. And it's 6.1 increase when we say that, but when we see people modelling those behaviours. So again, that story that I saw in Pharma and Focus, it just sort of rang very true, because often we find it very difficult to take the time to look after ourselves and to model that behaviour. And if we don't, it really clearly knocks onto those folk that we work with or work for us. This one, I'm just going to quickly, I'm conscious that we're at 9:50, so I just want to quickly talk about this one as well. I want you to think of this as a bit of a kind of a channel strategy in terms of how we engage both the empowered and higher trust and those lower. Fortunately, for those, no matter where you are, if you're empowered with high trust, if you're unempowered with lower trust, the primary care provider is the most trusted to tell the truth, right? So this is a really good sort of starting point for us to recognise that the primary care provider is there, and so is the pharmacist for most counts. There's something going wrong with those who feel unempowered and have lower trust with pharmacists. We need to dig into that and get a better understanding of what's happening there. But by and large, the primary care provider, so the GP and the pharmacist, are clearly being seen as the most trusted to protect the health of the public. And friends and family are as well, although we all know that friends and family have been counted as those ones who are kind of telling us, providing us with misinformation. So there's a balance there around what takes place. Importantly, I just want to go down to journalists. So across all audiences, there is this crisis of trust with journalists and journalism, but media in Australia continues to be consumed. We know that there is a challenge around media. We know there is a challenge around journalism. However, journalists still play a critical role in informing the public about major health initiatives that are taking place. So the question that we as a group need to ask ourselves is, when we're talking to either empowered, high trust, unempowered, lower trust, where are they getting their information from? And how can we impact those channels? We know they're getting information from social. We know that they're getting information from their friends, but we also still know that traditional media is one of those channels. They keep watching it, but they just don't trust it. So part of our job is to think through, well, what's our responsibility? How do we help Australian health journalism rise to become credible and to increase levels of trust again? I would encourage anybody, if you're in a consulting role, if you're in an in-house role, to think really critically through how you can engage with healthcare journalists, in fact, journalists across the country, because there aren't many healthcare journalists left, to increase the level of credibility. I, for one, don't want to see a country where we don't have solid free press, where we don't have various options. And I want to make sure that there is a commitment, given the type of work that we do in this sector, to ensuring accuracy and fairness, and the work that we do with our MedReg and our legal and our communications partners, our marketing partners too, to ensure that we're using those channels appropriately. So importantly, last one I think I might present before I kind of pack up, to change your mindset. We've given each of those different groups a little title, right? So you can see if you're unempowered with higher trust, you're kind of differential, right? That's the way that we're thinking. The way to move that person to empowered with high trust is to convince them that they're an equal partner in managing their trust, right? So this is the kind of person that we want to say, listen, this isn't happening to you, it's happening with you. You get to ask the questions, you get to ask for a second opinion, you get to do your own research, but you have to have that conversation with someone who really knows what they're talking about. So you're an equal partner in that conversation. And if we can do that, they'll move into the right-hand, that top right-hand box. For those that are unempowered with lower trust, they're clearly disengaged. So our job there is to improve their confidence and their know-how for managing their health. It's to give them primary communication around disease awareness, around the system itself, educating people about how to use the solutions that exist. You heard me earlier on talking about one of those key barriers being access and people just not feeling like they understand how to use those tools. I'm sure many of us have experienced the challenges that goes with navigating the system. If we want to move them into that top right-hand corner, we have to improve their confidence and know-how. And then finally, that bottom right-hand group. So they're empowered, but they have lower trust. This is my mate, John, right? This is John. He is skeptical. So what we want to do with people like John is to think about how we can show him that the health system is working for him, not against him. It's to remove that skepticism and that scaremongering and those kind of those theories that people, those Reddit threads, that this is something that is actually for your benefit, not against you. So I'm conscious I'm at 5 minutes. I just want to wrap up quickly with the 4 kind of key themes that or recommendations that we are taking out of this year. And the first one is around credibility and responsibility. So you've heard me talk about how information has exploded and how to earn trust, companies are really expected to be a reliable source. We need everybody that's on this call, our partners within the healthcare community, to remember that we have an active voice and that we have an authority and we have a responsibility to provide clear and engaging information. The second theme, however, is that we have to ensure that it's delivered through the right channels, right? Again, we've painted a pretty stark picture for journalism in Australia. It is not to say that it's dead, but we have to be very conscious of how we deliver it through channels and what kind of content we communicate as well. Often when we're being asked to consult companies, we're being asked to look through a single lens. Often that is an earned lens. More and more, we're taking a step back and saying, well, hang on, let's think about this human. Where are they? How are they actually getting information? How do they feel about the sector? And if they do not trust and they are not empowered, it doesn't matter what our product is or what it does. If we don't communicate appropriately through the right channels with the right voices, they will reject it. And in fact, this is probably one of the most significant challenges with the Australian federal government at the moment. They have a very particular recipe for the way they like to talk about major health initiatives. And based on our data, that's not going to work. We're going to have great initiatives that are not going to see adoption and uptake because Australians have this high level of skepticism and distrust of government until they start to switch to talking to using other voices first. We're going to see this thing happening, which gets me to empowerment. Patient empowerment. It's so great to see, right? We want to make sure that we enable people to participate in their health decisions. We're lucky in Australia because we have a system that provides for a really great group of patient advocacy groups who are sophisticated and locked into the system. That is not the case across the region, and it's certainly not the case globally. And then this last piece is around systemic change, right? We want to be acting as partners or as catalysts, and we want to make sure that companies take the road to get their heads above the parapet, to have a conversation, and making sure that we're seen to be serving the communities and not ourselves. So, man, I've had to rip through it with 2 minutes to spare. I might just check in the Q&A. I'm just going to go to, it's Leo Gironda's question. I might just grab that one quickly. And by the way, this is great. This is a great question. The question is, with the slow decline of the relevance and trust of mainstream media, do you think that the primary source of health information could sit with the brands in the future? So I think the short answer is yes, but not solely. My answer to that would be that the brands themselves, and when we say brands, I think we talk about companies as well as portfolios. The brands themselves have a responsibility to educate. However, we can't do it alone. I think this is probably the key thing. Unfortunately, we're still seen as a sector that has commercial outcomes, and we do, right? We shouldn't be ashamed of that. We're commercial organisations. We're seeking to make money. We need to make money in order to operate. We're in this space that there are ethical considerations where we have to be very careful about the work that we're doing, because we're not just trying to sell you a television. We're trying to help you live a better, longer, healthier life. And so the ethical consequences of what we do are very important. So I would say that, to answer your question, the brand has a responsibility to start the initiative, to push the ball, but we have to do that in partnership with those other stakeholders. And it starts with patient advocacy groups. It starts with health systems. In many instances, it could also be a role that you play where you're thinking critically about how you affect policy. And that's probably one of the key things for us when we think about being creative marketers and creative communicators. I think that's why we get out of bed. That's why we want to do these things. We don't just necessarily want to get up and sell stuff. Otherwise, again, we probably would work in the technology space, or we'd go and sell cars and things like that. We have a responsibility and a vocation which is about helping people live better lives, and we're doing that through creating access to over-the-counter medicines or products that people can get in the retail and grocery channels that allow them to make better decisions. And that's about getting fast, cost-effective access. So, yeah, I think that's a great question. And for me, we have to take responsibility for starting that. And often that's going to be above the brand itself. It's going to be thinking more broadly. And we've seen this happening. I'm sure you've all seen work that's happened from different companies in Australia and different companies regionally, where they recognise that there's a gap and there's a need with a social or a political challenge that is being experienced by people in a country or in a region. And they're taking responsibility of saying, you know what, we're going to do this. Obviously, the OGs of that is Unilever and the work they've done in women's health and body image and empowerment. They've been doing this for 25 years-ish, something like that with Dove. And I always like to say, if you can do that with a bar of soap, I'm pretty sure that we can do it with some of the novel and fantastic products that the people that are on this call and the companies that we represent produce. So, all right, we're right at time. Dion, should I swing back to you?
Right on time. Will, thank you very much for a wealth of fascinating insights. Absolutely wonderful. You never disappoint. Thank you very much for that. And we're looking forward to welcoming you back when there are new insights and data to be discussed. So thanks to you, thanks to the participants. We really appreciate your participation. Will has agreed for us to share the presentation with you. So we will be in touch. Thanks, everybody. Have a lovely day. Stay warm. Thank you.